The potential advantages of technology in enhancing mental health care are increasingly becoming recognized and appreciated. For example, the use of computer tablets to support psychotherapy and promote behavioral change among patients with severe mental illnesses is gaining momentum in Uganda.
Mixing technology with the structured intervention was so interesting. It made a very big difference, because you would be able to have a holistic review of the patient and give that patient time to be able to tell you more about the issues that we used to leave out. Issues like job situation, accommodation, family relationships, because those things we would not mention them in the clinical setting.
The use of tablet computers to manage severe mental illness was introduced to the mental hospital by a team of researchers from Makerere University's College of Health Sciences and the Queen Mary University of London. The researchers were undertaking a study to identify low-cost psychosocial interventions for severe mental illness. They labeled this particular intervention Dialog Plus.
The Dialog Plus adds on an intervention which is called a solution-focused therapy, where someone looks at those domains and understands why is someone not feeling that way. Now, in this intervention, we looked at people who have severe mental illness, and we actually found that those who took part in Dialog Plus at the end of 6 months reported a higher quality of life. They also reported increased adherence to medication. We had a total of 168 patients initially at the beginning, and then we assessed them at the beginning and at the end of the intervention.
Gertrude Nachiaga, a patient at Butabika National Referral Mental Hospital, has had a series of therapeutic dialogues delivered via a tablet.
Ekisinza okunsanyusa counseling ya dokita wange. Kuba olulala waliwo enajjira nga ndina mu maziga nga sinadde ssente zirabirira abaana, nkola naye akasaala katono, dokita ng'oyo yaŋŋumya naŋŋambira wadde kati ky'oba okola funayo ka bizinesi akalala k'otandikawo. Kati bwe naddayo era ne nkitandika, ne ntandika okwesiikirawo busumbusa obutonotono, natandika olaba nga ate ŋŋanyiddwamu nga kinsanyusizza nnyo. Kyansanyusa nnyo ne ŋŋamba kirungi okumiitinga baddokita nga bakwagala.
2 years on, Nachiaga, a 42-year-old mother of 3, is stable, adhering to medication, and has diversified her source of income.
Enjawulo mpulira y'amaanyi nnyo kuba kati okuva nalitandika ndi mulamu bulungi, sirina buzibu okuleka jesi kino obulwadde bwa pressure.
She owes her positive progress to Simon Dira, a psychiatric clinical officer at Butabika Hospital. Using the Dialog Plus intervention, he was able to unearth all relevant information from his patient, clear blind spots, and spur her to translate her dreams into reality.
Whenever you bring Dialog Plus on the table, it exhausts different domains. And whenever you exhaust them, then that implies you are able to tap the cause, you get to the root of the problem. And you are able to help this person to function much better.
Like Dira, Rona, who has worked in a Butabika hospital as a psychiatric clinical officer for over 20 years, says Dialog Plus has helped her understand every possible nuance of Connie Zawede's multidimensional story.
So it gave me a holistic review of the patients and be able to understand them better, and it helped also the patients to be able to open up.
Before I came to Butabika Hospital, I couldn't do anything at home. I couldn't sweep the house, I couldn't mop, I couldn't wash dirty plates. But after accepting the medication in Butabika Hospital, it has built me mentally and physically, which makes me very happy, because if I hadn't met the Butabika people, maybe I would be someone very different.
This has enabled the clinical officer to enhance therapeutic dialogue and improve patient satisfaction with the mental wellness services she receives.
The training of Dialog alone is enough to have an impact to a clinician on the way they perceive the patient, even without using the application. So you find that even if you don't have the application, after you getting the training and learning how to use it, you end up going through the dialogue-related domains, and you end up discussing through the 4-step approach, even without the tablet, because you know it. So you feel like this patient should have a more detailed discussion, and you find that dialogue just brings out everything more clearly.
As a new low resource-oriented intervention for low and middle-income countries, Dr. Bidabwa is now calling for the rapid scale-up of Dialog Plus across Uganda.
This is some intervention that you would want to scale out because it gives a skill that probably we don't emphasize much when we are training mental health professionals, and it's a skill that can be done, it can be easily incorporated into general care.